Right, this is my introduction to the department. So, yeah, next slide. Some of you may know this man. I don't know. This man is called Gaspare Tagliacocci. So there's a story to it. He is thought to be one of the fathers of European plastic surgery. And the story is that there was a family in the south of Italy who performed a sort of nose reconstruction, right? So it was a secret to that family, and the father passed it onto the child, onto his son, as a secret technique. So there was a man, Leonardo Fioravanti, who went there to learn the technique and published a book about it. So this man writes that he got there and he wasn't allowed to see anything, so he pretended he was sick, and he writes, "From the corner of my eye I could see the whole technique, pretending I was afraid of it," and published a book. And that book inspired Gaspare to develop the technique and to publish the first book in plastic surgery in Europe, and in the book in the world as a proper book. So I wanted to tell you this to thank you for welcoming here and showing me everything you do, because it is priceless to me to be allowed into your ORs without any kind of restriction and everything. So thank you. Next slide. Well, I'm from Lugo, which is a town in the north of Spain. Spain is known for its hot weather and sunny days, but we unfortunately don't have that in the north of the country. So we have a weather more similar to the UK or to Ireland, more rainy and foggy. And this is my family: my father, my mother, and my little sister. We're also famous for our Roman past, which is the Roman wall of the city and the Roman bridge, and our seafood. And we also have this is UNESCO's World Heritage, a beach we have there, so you're welcome to come whenever you want. At the age of 18, I moved to Madrid to study medicine. This is my university, la Universidad Complutense de Madrid, and my graduation. And then I chose to do plastic surgery in 12th of October Hospital, Hospital 12 de Octubre, another hospital in Madrid. Excellent. And I'm also from Istanbul because my father is Turkish, so I'm half Turkish. And this is my home in Istanbul. This is me with the mosques, and it's a very beautiful city. You know, it is between Asia and Europe because it is split by the Bosphorus Strait, and you can cross by boat from one side to the other side of the city. So you're also welcome whenever you want to Istanbul. I highly recommend it to you. So this is the team in Hospital 12 de Octubre. This is me, Asier, and Jose Ramon, who was here the last year in a quiz show in the National Congress of Plastic Surgery in Spain. And there we are. Next slide, please. I also brought you some cases. We usually have 2 to 3 cases of microsurgery per week. So this is an ALT we did for ankle coverage and with Achilles reconstruction with fascia. So there you go. This is the insetting. We made a neo tendon with the fascia, and this is the final result. In this case we had to take the fascia. When we cover, we do lower limb reconstruction with ALT. We aren't as brave as you to think it so much, but there were. Yeah. This is another case. This poor patient was a woman with an angiosarcoma. We find out she had skull invasion intraoperatively, so we had to call the neurosurgeons. They took out the outer plate of the skull and cover it a part of the skull and cover it with that plate. We also did the neck dissection. We took out an latissimus dorsi with serratus, free flap, and we inserted it like this. We also have many more cases. You asked for the phalloplasty before, so this is a case we did. We don't have any sex reassignation surgery unit as itself, but we managed to do some reconstructive phalloplastic cases. This was a vesical extrophia case with aplasia of the phallus. So we did this is a normal coverage with the LT flap, lower limb coverage, and this is a free jejunum for reconstruction of the neck. This is a loop, an arteriovenous loop we had to do for a defect in the area of the knee with a latissimus dorsi flap. And this one is a deep flap because this patient was really fat, and he had a huge sarcoma defect in the hip. So we just took a normal DF flap, free DF flap, and we inset it, and we managed to get such a good contour with the DF flap. And then he told us in the room, it seems like you took nothing from my leg, because he was so fat that he still had more skin to take if you want. So next slide. And we also do other kinds of surgery. We do hand surgery. We have a bit of a conflictive area with some conflicted patients, some gangs, aggressions, and that stuff. So many cases many hand surgery cases we have are knife wounds. So here we did a revascularization of several fingers, and there we did a K-wire osteosynthesis. This we also have infections. This is a case, a rare case of mucormycosis, a fungi infection of the lower limb that we ended cutting off the limb. So this one I brought it because it was very strange, but we have maybe 2 or 3 cases of necrotizing fasciitis each year. We do also some contour surgery, body contouring surgery. This was a tuberous breast. We solved it normally with a pocket flap, and this was a post-bariatric abdominoplasty, a normal post-bariatric abdominoplasty. And this is the last slide. So to sum up about me, I did a medical degree in the Universidad Complutense de Madrid, as I've already said. I'm a 4th-year resident, plastic surgery resident in 12th of October University Hospital. I've been to several courses and meetings. For instance, this is me raising a deep flap in a corpse, in a course. And I've also modeled in some courses, because this was a course I attended in 2024, that for the 2025 edition they took my picture and used it as an advertisement. So I think I may have to ask some money for it. And I've also been observing in these 2 hospitals, learning hand surgery and pediatric plastic surgery, and I'm also assistant teacher in these 2 universities. So that's it. Thank you for welcoming me to the department.